I'm Crystal Sparks here at Scientific Sessions, where I am joined now with Dr. Mike McConnell. He is a clinical professor at Stanford University, and we are talking about using technology for preventative care. Tell me what that means, how we're doing it, and why it's important.
Ooh, awesome question. Love to be able to talk about this. We chatted a little bit earlier. My passion for the last 10 years has really been to do prevention at scale. And we have all these technologies now that are available in clinics, in homes that you can wear, that really help with early detection of heart disease so that we can get you on good prevention program, prevention therapy when needed. It's an incredibly preventable disease if we catch it early, right? I view it as a failure if I see a patient in clinic and they tell me they just were in another hospital, with a heart attack. It's like that. I didn't do my job if that happens, right? So for me, it's helping people understand that heart disease is preventable, partially through, all the good lifestyle, healthy diet, physical activity that we promote. But in some people, as we get older, we need to look at your numbers and see, do you need a screening test to see, has disease started building up in the heart arteries? I know it sounds a little scary, but I actually use the cancer analogy, which is, we have tests that at a certain age, women get mammogram, men and women get colonoscopies. We know there are things that relate to, that you can help prevent cancer, but we don't skip that. You get to a certain point, you need to get checked. That part of my work with the Heart Association over the years made me realize that not enough people are recognizing that they have the risk factors, they may have early disease, and so all the powerful therapies that we're seeing developed around us, they don't help anybody unless they, get detected and get on therapy. So I ended up writing a book called Fight Heart Disease Like Cancer, particularly to try and help people understand there's a lot of similarities in both how you can prevent it, but how we need to be screening for it, and we have therapies that can prevent you from ever having a heart attack and stroke. But it's got to start with the prevention side, early detection, and I think employing health technologies to do that has been what I've been trying to work on for a number of years now.
So it's pretty obvious that you're not just a doctor. You also, you wrote a book. You're also advising people and doctors and organizations and associations. Can you talk a little bit about that? And I want you to talk to me about the passion you have in and behind what you do in your advisement role.
Yeah, I'd say, it started where I had the traditional academic career where you do I worked on a lot of imaging. But I started realizing as I was running the preventive cardiology clinic at Stanford that, people need help with understanding heart disease better, monitoring it better, early detection. And that had me do this career shift where I actually worked with Google for many years. I had done a project with Apple and really got me into this is an opportunity to use these modern technologies we have to reach many, many more people. Not enough people are getting good access to care. So we need to move outside, what we call moving outside the four walls of the hospital and the clinic to reach people where they are, broaden access to care, and particularly people who don't have a good access to care are often at the highest risk, both for early disease and for heart attacks and strokes. So technologies that help us reach many, many more people has been what I've been excited about. And, I've loved the fact that the Heart Association has really leaned into how to use technology, how to use it to improve broadening care, but broadening the equity of the care that we deliver.
What would you say to someone who's on the fence about whether or not they want to come to the scientific sessions? Why is it important to come here? Why do you think people should come here?
Well, it is the latest and greatest of all the science that's going on. So, I started on the science side. I was an engineer to begin with, so I love coming and learning the latest science. But particularly a lot of what goes on in this hall is, how do we translate that science into helping people? And I think my other favorite part is I see lots of people I know and we get to talk about collaborating, and, we just had a conversation of this company is helping bring more people, recognizing they're at risk, and this company is helping people who are at risk. How do I get more details and personal about how bad your risk is? And those two companies start talking to each other, and you can, have these productive collaborations and do more to, bring all this technology to help more people.
Well, I would say this is a productive collaboration right here, us talking. Thank you so
I
much,
love it.
Dr.
Thanks
Ryan.
for your help.
Yeah.